Hi, I'm Lauren Speakman here at the Harrison School of Pharmacy at Auburn University. It's National Pharmacist Week and we're about to hit the concourse to see what people actually think pharmacists do. Let's go!
Alright, so what do you think pharmacists do?
I'm honestly not exactly too sure what pharmacists do, but to my knowledge I believe they prescribe medications, and that's all.
Alright, so pharmacists distribute medicine to people who are sick.
They count the pills, I know that.
They count the pills. I think pharmacists give medicine to people. That's honestly what I think they do.
I'm gonna be quite honest, I really don't know, except for I go and pick up medicine from them at the CVS or something like that.
What was the question?
What do you think pharmacists do?
What do pharmacists do? Well, they give me medication when a doctor prescribes it to me.
They fill prescriptions and hand you the pills.
Yeah. That's what I was going to say. You stole what I was going to say.
So what do you think pharmacists do?
Well, I'm not sure what pharmacists do, but I know one thing. They're always in Starbucks buying our coffee, so I'm really appreciative for them.
It's true.
Anything else?
Come on. Don't they like make the medicine? Right?
Make it? Yeah, they make it.
They do hand make it. You can make
they
it.
don't.
Yes, they do. I promise you they do.
Well, I feel like pharmacies is what I usually see people in the drugstore and they give drugs and things like that.
Honestly, I think pharmacists really just, they get medicine and they measure it and they find the right prescription to give to
Yeah, I think they're in charge of all the prescriptions. Yeah, pretty much. I see one by
So first thing that comes to my mind is working at like a CVS, filling prescriptions for pills or something like that.
I guess pharmacists just know a lot about drugs.
Well, pharmacists are responsible for keeping the world medicated.
Work with insurance companies.
Make sure people get the right medication.
Yeah, I know. You don't want to screw that up. That'd be really bad if you mess it up, so.
And help people feel better.
Yeah.
Pharmacists really bridge the gap between a doctor and a patient.
Personally, I think that pharmacists are kind of like the unsung heroes of the medical profession. I think that they do a lot behind the scenes that people kind of don't take advantage of as much as they probably should.
But yeah, I think pharmacists like the quarterback of the medical team, They keep everything in order, make sure everybody's getting the right things going in the right places, and so that's what I think pharmacists do, make sure everything's in order.
Through our time interviewing Auburn students and the faculty here at Auburn University, we realized that students and faculty and the community in general don't realize the services that a pharmacist can provide for them. This was an excellent opportunity for us as students in pharmacy school just to go around and educate people about what a pharmacist can do for you. While we were interviewing, we realized that retail pharmacists are actually the most common pharmacists known because they are the most accessible healthcare provider.
And of course, retail pharmacists play a crucial role in the health of our patients, but you can find pharmacists in so many other areas, including in hospitals, in outpatient clinics, academic institutions, in the military, and in VAs, and many more. When the community doesn't realize the many ways that pharmacists can serve them, they really do themselves a disservice by underutilizing the services that we can provide as pharmacists. Pharmacists can perform regular health screenings right in the pharmacy, including checking your blood pressure and checking your blood sugar on a regular basis. They can also counsel you on how to control these levels and what levels you should be aiming for. A pharmacy is a great place to receive not just your flu shot, but any vaccine that you may need. Your pharmacist can review the vaccines that you've already received and inform you on the ones that you should receive. Pharmacists can perform basic physical exams and advise you on the best next steps to take if any abnormalities are found. This is to make sure that you stay in the best health possible. Pharmacists in the community setting are the most accessible healthcare providers because you can talk to them with no appointment needed. They are your medication experts and are there to make sure that you safely take your medication and get the most benefit out of it possible. Pharmacists are there to keep you healthy and out of the hospital.
We hope that National Pharmacy Week can serve as a catalyst to spark a conversation between you and your pharmacist and help build a relationship and find out what they can do for you.